Very good morning to all of you. With the permission of the chair, Dr. Zhang, and everyone else, and the minister and the officials from the government, we are very happy to start the discussion on how to formulate our response. We include traditional medicine in one of the very important documents which are coming out of the UN system, which will make sure that the United Nations, the entire United Nations, will start looking at traditional medicine in a more comprehensive and more important manner. There is one, as a background, I can tell you that there is one very important meeting which is happening in United Nations, which is the UN high-level meeting on universal health coverage, which is happening on 23rd of September at New York. And that is one place where all the UN organizations will come together and they will be discussing about the SDG Sustainable Development Goals, this is the last chance for us to put in any kind of information in that particular document, which in 2023 is the mid-year period of review of that SDG. And to get into the mid-year review and the action programs till 2023, this is the last opportunity for us. So what had happened until now is we had, as traditional medicine unit, as well as with the help of many member nations, we had been discussing with the secretariat, and a considerably good document had been approved and by the executive board, which was conducted in January. And further to that, the executive board had put together a group of expert committees, which is headed by a few countries, to develop the new document, which will go as the declaration in the UN high-level meeting. But the draft of the document, the latest draft of the document, has recently been published in the website. It is available for you to. It came in the website day before yesterday, and what we are trying to do the whole purpose of this meeting is to evolve a consensus on what we can speak over there. What is it that we should try to include as part of traditional medicine in the UHC declaration, which is going to happen during the UN high-level meeting in September. So, since we have a lot of us around here and we have a very limited period of time, I would suggest that we can probably divide this into understanding a little bit about why we should do it. That is very important, and for that we should try to probably focus on what are the problems which we face when we try to put traditional medicine into any of the major documents, which are international documents of like intra-governmental organizations. So then you formulate what your suggestions are. One of you, there are 6 groups I have seen which are formed on its own. So if one representative from each group could speak for about 3 minutes, and give option for anybody else from the group to add on something for the next 1 minute. So you have 4 minutes for each group. So if you can, like we don't have anybody to suggest, so anybody can, like from the group itself, somebody will have to speak up, and I will start writing. No. You are trying to write down what the roadblocks are as we decide, or as we feel it.
Geetha, could I start as the first presenter for this?
Please use the mic.
Okay. If you can hear me, I'm happy to do it.
No, but there are people in the feedback. So there are about 20 people in the feedback.
Okay, sorry. Thank you. Can you hear me? I don't know what's the best way to do this. How did I just go on?
You can also. Yeah.
Thank you. Thank you. Okay. Thank you. Thanks, Geetha. Thank you for bringing us all around on this wonderful meet. the group that we are there, we've identified 2 areas where we feel there are roadblocks. And these are major roadblocks. They've been around with us for a long time. Number 1 is distinguishing health from healthcare. And what we have today is the healthcare paradigm masking the growth of the health paradigm. And wherever we have a discussion or debate about anything, it's overtaken by the healthcare paradigm. In that we don't think of health, we cannot think of some other way other than healthcare. And that any dialogue, discussion we have, whatever we are trying to do, including traditional complementary medicine, which is discussed here, will fit on the right-hand side of your problem. It will only be seen as trying to get people well and not about looking at health, number 1. So we feel whenever we present anything to do with traditional complementary medicine, it must be, of course, our dialogue will go towards the right-hand side on your chart, but we must stop people and make them think a little more about the left side of the whole issue. And the left side is very important because that is the bit that connects with the Sustainable Development Goals. And we must find a way to highlight how it connects with the SDGs. I think the minister from Curaçao gave us the best example of how it connects with environmental issues. The point highlighted about food was very important, the connection between food and health. Food becomes a central part. And these are principles that are laid down in all the traditional systems of medicine, Chinese system, in the Indian system. Food is a central aspect. So wherever possible to bring the debate and the discussions towards health. The second thing we identified, the group identified, is about the current scientific paradigm. The WHO and every member state believes that it has to be science-driven. But the entire scientific paradigm is biased towards satisfying what you have on the right-hand side. We must find new scientific parameters that bring us to the left-hand side of your unequal equation there. So these are the 2 things that we've identified. We want clarity in understanding what health is. We want clarity in discussions where when the science is questioned, it will highlight personalized therapies as we have in Chinese Indian systems. Those issues must come out when you design experiments, how we accommodate that. Thank you very much. I think that
From the same group?
Same group, yeah.
Yeah, please.
Perfect. Just as an extension to what Madan was saying, I think one thing that struck me from the background and reference material is that the one area that wasn't, it was mentioned in terms of Astana acknowledging that scientific and traditional knowledge needed to inform healthcare development and universal healthcare. But it wasn't bolded, it wasn't identified as a key core issue that really filters through down to everything else. So I think by really reinforcing the fact that traditional knowledge can actually inform universal healthcare in a patient-centered way that is health promoting, that actually has, as Ed Kelly was suggesting, a preventive, not just curative approach. If we really make that a lot more overt, I think that can actually help change, because there's this notion that scientific medicine is real medicine, traditional knowledge is not real knowledge, but it's societal knowledge and we should consider it, but it's not as important. So I think we need to stress how important it actually is. Thank you.
On the same?
No.
Okay, right.
In our group, so just finishing off part of the conversation about research, one of the things that we highlighted as well is that it's often stated that traditional complementary medicine is not research-based. And I think it's more that people aren't aware of the body of research. So there is an extensive amount of research in, let's say, acupuncture, in Ayurvedic medicine, in naturopathic, whether it be in herbal medicine or nutraceuticals. So I think that we need to, as a group representing traditional complementary medicine, not reiterate that belief when that belief itself is not based on research. So I think part of it is really understanding the research base we're working from, and that's one of the things that we've been doing over the last year for naturopathy, which I'm going to share with you tomorrow. But I think that's important to actually do. The second thing is that when we, in this standard declaration, a lot of it talks about patient-centered healthcare. One of the things that we're finding and that we talked about is that healthcare is almost being patient-driven. And one of the reasons for, so it's the opposite of what you're saying, but one of the reasons for ensuring that TNCM is included in this discussion is because civil society wants it. And that's an important thing to keep in mind, is that when we look at patient-driven healthcare, or even patient-centered healthcare, one of the things that is part of patient-centered healthcare is patient choice. And that is important to include. The other thing that we looked at when we had done a survey last year on the attitudes towards interprofessional collaboration was ensuring that interprofessional collaboration is respectful. Because there was a big concern when we were talking about two different systems of medicine, is that it has to be done from a position of respect. There needs to be models that protect the systems of medicine, and that is not cherry picking, that sort of thing. So respectful collaboration is what's really important, and that includes models of working together, models of integration, and looking at like comparative research as opposed to just the presence of research, yes or no. Anything I missed?
Your 3 points that he writes it down.
Yeah, he did. He did. What? Oh, so the other thing that came up was just when we look at the obstacles to integration is sometimes the lobbying power of pharmaceuticals against integration, right? So that's an obstacle. But I think the other ones talk to more about how the motivation and how we can address this problem.
Yeah. Thank you.
Yeah, we look very specifically at the barriers and the. Oh. We look very specifically at the barriers and the obstacles to integration within healthcare systems. And we felt that one of the principal barriers, not in all, and some of the ones we've heard this morning, clearly there is a very clear understanding of TCM. But in many countries around the world, there is a lack of understanding with policymakers. Many of those policymakers may have come from a background that hasn't given them any exposure to TCM. So the lack of understanding and knowledge in relation to it, I think, is a significant barrier, and this is something that we looked at. Another obstacle that we considered was relative inconsistency of education across the provision of TCM. So we felt that solution-based approaches may look at harmonizing the transferability of education across jurisdictions, so that a health professional in one country looks the same as a health professional in the same profession from another country. Another obstacle that we encounter much of the time is a lack of regulation, a lack of registration, and a lack of title protection. And the strength of various professions across the TCM field is not helped by the lack of regulation. So anyone can call themselves an acupuncturist or a chiropractor or a homeopath, and I think that the lack of regulation is a barrier, I think, to that integration, because I think policymakers want to be reassured when they look at these professions that there is that. A consensus of what evidence-based care looks like, and we've heard it a little bit today, and that evidence-based care is not just about research and science. It's about clinician experience, and it's about patient values, and it's integrating those three elements. And I think that sometimes we don't do a good job in talking about evidence-based care when we don't mention the three elements and the importance of the wisdom of clinical practitioners. And we talked about the traditional values of complementary medicine going through generations and beyond. And lastly, we covered the risk-based approach to healthcare, and what does a risk-based approach look like in TCM, and should that be dictated by the risk-based approach that's used in conventional healthcare, pharmaceutical industry, where arguably the risks are much, much higher. So we're looking at a proportionality of a risk-based approach to the integration of TCM. Did I miss anything?
No, that's fine.
Yeah.
If I can add something just based on what Richard was saying, I think it's important for us to highlight the fact that says that we're not comparing one system of medicine to another system of medicine. In traditional complementary medicine, there may be 12 core systems of TNCM, but there's probably 200 other TNCM systems, practices. So, and within the TNCM field, we have doctors, we have practitioners, and we have wellness coaches. So what is often missed is, yes, there's a lack of knowledge, but there's also a lack of appreciation for the expansiveness of the field of TNCM. And that is, and that's what I'm saying is when we're comparing, what a medical doctor can do, that's not going to, and we're comparing that to the field of TNCM, we should be comparing that to the practitioners in TNCM who are trained at that level. Right, and so that I think gets us into trouble, is because we're grouping everybody into one versus recognizing that some are trained as doctors, some are trained as 2,500 hours as therapists, right? And some, like you did a wonderful job in clarifying the fact that says you have the wellness coaches and you have you have the medical trained practitioners, and then you have the people who are specialized, and that's important for us to highlight the complexity of the field of TNCM.
In addition to two small issues are there, the one thing is the introduction of modern technology. We find that TCM, the modern technology is not introduced much, and there is not much database is there. Okay, if you want to control, if you want to regulate, you need to have the data. So that aspect is lacking compared to the other system of medicine. So that is also hindering spread to various countries. And another thing which we noticed that the language is used is a local language. Like Ayurveda, it is a Sanskrit language. Siddha, it is a Tamil language. So that is also some translation or something. If it is done to some commonly accepted languages, it will lead to the spread of this education.
So our group came to pretty same observations. The first input that will be commented is that somehow health, if we focus on health, it will kind of question or destabilize the current economic system based on healthcare. But someone will talk about it. But then we felt, what can we do practically now? Next steps. One thing we feel is that research, which is an important tool because it's a language that connects us to the existing prevailing systems. So research should be developed according to the needs and particularities of the different disciplines. And governments definitely can give funds to develop research, to develop research methodologies adjusted to the discipline, train people. That would be a great thing. The government can do that. It's not such a big thing. The other thing is that, except few countries like India, China, Switzerland, everywhere the main tools of therapy are medicines, are only recognized as food supplements or cosmetics. And it is not normal. There should be an effort made to get them recognized as therapeutic products. And another point was, and they should be reimbursed. Because if people get free allopathic medicine, but they have to pay the natural medicines, this is an obstacle too. So these were our three main points. And some person doesn't want to add anything.
You did it perfect.
Our group has identified the main core problem, which is in line with the report. It says that lack of research data. So research is the core thing, as opinions conveyed by the other groups also. So research is the thing which creates the acceptability. If you are saying there is the acceptability at two levels, one is acceptability as mentioned at because of the patient-centric. As in we have seen, being practitioners of Ayurveda or Ayurveda system of medicine, actually there is no problem at the level of patient. Patient all requires to cure, to get relieved of his pain or ailment. So he is not really bothered about the research. He wants the relief, and that is happening. The acceptance at the patient level is there. But when we are speaking about the scientific community, so there's a lot of there's a knowledge gap actually, which is prevailing in terms of producing good results, which can be made and proven at that scientific language which the contemporary modern system has. So the major lacuna what we have discussed is that the methodology. The methodology, as suggested, like we need to have a methodology for the TCM. So that should be the prime and most important step of developing our own methodology, because what we are facing, being a research scientist, what we are saying is there's a proper methodology which is available in the modern system of medicine, but because of so many difference in the principles, the concepts, we can't actually blindly follow that methodology, and it is like we are forcefully putting Ayurveda and trying to get results, and which may actually not give the results. So the developing of a research methodology is a key point. For example, we need to have, like, there's an evidence pyramid. So we suggest that there should be a separate evidence pyramid for the TCM, which cannot be actually what the modern, because Ayurveda, there are a lot of things which have been already mentioned, documented properly. For example, if I just go into detail, like there are studies of cohort studies as well as case control studies. Cohort is a prospective, wherein you can establish a causal relationship between a outcome as well as the positive factors. But it is highly expensive and time consuming to develop a cohort study, but it is considered as a good evidence base. But whereas the temporality is already established in Ayurveda, that is due to this causes, this disease or these symptoms will be formed. So there is a temporality which is already established in Ayurveda. So if we are doing a lower level of which is more feasible study like case control study with Ayurvedic evidence, so we need to amalgamate and try to create a new pyramid of evidence or anything evidence pyramid, so that for traditional medicine there can be, it should have this uniqueness. And as the others have told, that we need to have the respect and give importance to the principles which the traditional system of medicine already has. They have a lot of data which has already been documented. So we can't say that data we can't accept. Only if you are preparing the fresh data only can be accepted. We need to give due importance to the data which has already been generated and documented in various texts. So we need to formulate, we need to have a full-fledged research module or the methodology, so that then we can have, we can develop this TCM, we can produce, we can we can convey, have a dialogue with the modern medicine.
The last one.
In order to achieve this goal, since the aim of research on TCM is usually to be able to convince the scientific community and the health authorities about some aspects of TCM, it should be done from the very beginning in collaboration with representatives from the scientific community and health authorities. So if the design of the research is done with such collaboration, then these authorities will be in a position to see the results as valid, and they can influence the health policy.
I'm waiting for the moderator to also give a sign to me. I'm going to close the last. Or you asking a small group?
Okay. This for the group or?
No, I don't know what
The
you
group has already
asking me to.
spoken?
The group there, who's like to say, you say something from group?
We were just looking at what are the possible ways in which to communicate at the high-level meeting. And one discussion which we had for a little bit was about just even the terminology that we are using right now, which is traditional medicine and complementary medicine. We are also looking at the possibility, because medicine per se seems to mean an input that you're giving to cure something, a problem that has happened that you're trying to cure. Instead, shall we look at the inclusion of traditional wisdom for wellness or well-being was one discussion that we had as a possibility, because that could be a little more expanded area where things like food we've been speaking about, and things like yoga, which may not be technically medicine per se, but rather actually have a broad-based definition. When you say well-being or health, say include traditional wisdom there. And within traditional wisdom, there could be research for specific systems of traditional wisdom, which is Ayurveda or whatever, where you have specific research cases. But there could be other aspects of traditional wisdom which could be researched upon specifically for their results, like the impact of yoga and other aspects. So that particular definition is also something we thought could be looked at.
Thank you. In fact, we have really run out of time. So our second part of the discussion, I've written down, and if you can leave your email IDs with us, we'll send you this, like the discussion points which we had identified as problems, and we would be happy to collect individually the suggestions which you have for each of the problems which you identified, and we can actually use this as a major tool when we start discussing within the unit and within the department and within the division about how to address this problem at the UNHM. But another thing which I want to request over here, it's only a request, that if every single person and organization here would try to talk to their respective governments and make sure that traditional medicine is appropriately represented in the by the delegation which goes to the UNLHM, and make sure that it is being presented appropriately in the declaration would be very, very helpful, because that's our next step which we have to do, and we can do what we can do from within WHO, but it would be a major support if NGOs with official relationship, and of course governments and even NGOs who are not in official relationship but as a public like organizations, if you can, civil society organizations, if you can converse with the UN election members who will be going from the health ministry. Each of the countries' health ministry will definitely send a representative. Usually, it's the head of the government or the head of the health ministry who goes for this meeting. So I think it could be something which would be very helpful for the whole purpose of whatever we have gathered together. I would request Dr. Zhang to conclude with this.
Thank you, Geetha. So for this part of discussion, I would like to remind everyone again is the aim is to try to get your inputs for the WHO for the support to countries for the September United Nations high-level meeting. So remember, so many obstacles or difficulties facing by this community, right? But for the moment, the most important to bring the policymakers, even the heads of each country, to recognize or to pay more attention to this part of the knowledge or the medicine. So that's most important, and we try to bring everyone your attention for the country delegations to how to work with the country's highest level to participate at the high-level meeting, to give a voice, to include, at least from countryside, and all other partners, either NGOs or other the stakeholders, if there is an opportunity to attend that high-level meeting, also give a voice. So we understood that for UN high-level meeting, that meeting document now is going to release the declaration of that high-level meeting. So that will be more, how to say, compared to the last year Astana, the primary health care conference, it's broader issues because all the president, the prime minister, right, the head of country will attend that meeting. So they will, we can imagine, expect that the future declaration of that high-level meeting is covering broader issues, not only health, but beyond health, that economic, culture, social, and the environmental altogether. So we can also imagine that it is most difficult for our traditional medicine to be included as a long sentence, even paragraph. That's not practical. So that's why we suggest how to support countries. So maybe only one single word can be included as possibility. So maybe traditional medicine. So some colleagues raised traditional medicine or traditional wisdom. So if one word only, the possibility to be included, what's the key word? Or if a little longer, maybe traditional and complementary medicine and integration, or that's the draft there. So what's the possibility? So cannot expect a paragraph or even a sentence. Imagine we tried very hard with partners last year. So for the conference, that within health sector, that primary health care, only 2 words included, right? One is traditional medicine knowledge, the other is traditional medicine technology. So that's because that's PhD also comprehensive. But this year we can imagine there's even broader issue. So we cannot expect a long sentence on traditional medicine to be included because the declaration is going to be also concise. And so that's the drafting secretariat will be United Nations in New York and supported by countries. So we are expecting more the contribution from the country level to the highest level of the country political leaders and also other partners to give the voice. So after this, thank you very much first for your excellent ideas and so the inputs to the obstacles and to the policy. We will record what you have said and provided and to see how to revise our, actually it's more on the background side of this page of information, and also some initial suggestion for the possible wordings for the future, the countries or colleagues to choose when you have a chance to revise the draft assembly revision. The secretary will request the inputs, comments from countries and maybe other partners. So you will have a chance to provide inputs for the revision of the draft declaration. So in that case, of course, what kind of wordings, depending on the future structures of that draft of the declaration. So just for your reference and remind everyone the importance of this coming high-level meeting. So particularly for the traditional medicine in the community area, if can be included as a wording, so will be very important. Even our partners, right, from the human rights that's perspective, if can give a comments and a voice to that, also very supportive. So and we will share the outputs of this meeting to broader the colleagues or partners, even the countries or WHO colleagues or the regions and the countries, to get further inputs for us as a WHO headquarters to provide support for the facilitating each countries and partners for the contribution to the future, that high-level meeting documents. And we also expecting continuing collaboration with not only the countries, policymakers, but also all the partners and with WHO and for the future. So thank you. So for the time being, we close our meeting. Thank you for your time.